Alright guys, today I will be talking about how important it is to get your child vaccinated. And after my speech, you'll understand why it is more beneficial to get your child vaccinated than to not get your child vaccinated. And what I'm going to start off with is a study that was done. And the study was that 25 children who had undergone their full course of child immunization were compared to 25 children who didn't have any vaccinations at all, for a period of 5 years. So they were in comparison with the diseases like measles, pertussis, poliomyelitis, tetanus, and tuberculosis. Now, out of the 25 vaccinated children, only one child had mild measles at 2.5 years, while 4 had suspected whooping cough at different points of the study period, but it was not clinically diagnosed as pertussis. But the 25 kids that were not vaccinated, that group, 2 died of measles before the age of 3 years old, while 11 others went down with measles during an outbreak in 1986. Also, an unvaccinated child also died of tetanus while during the study period. So, out of 25 kids who were vaccinated, nobody died, and only a couple were affected, but it wasn't that serious compared to the kids who were unvaccinated, where 3 had died and 11 were infected. So, what I'm trying to get at is it's very important and beneficial to vaccinate your children. The Centers for Disease Control and Prevention recommends vaccinations throughout your life to protect against many infections. When you skip your vaccines, you leave yourself vulnerable to diseases like influenza, HPV, hepatitis B, and those are leading causes of cancer. When you choose not to vaccinate yourself or your children, you put a lot of people at risk that shouldn't even be affected by it, that are vaccinated too. You put people with weakened immune systems due to other diseases or medications that they are taking. You put them at risk when you do not get yourself vaccinated or you don't get your child vaccinated. People with chronic medical conditions like heart, lung, liver, kidney disease, or diabetes are all affected also. And most importantly, which breaks my heart, is that newborn babies that are too young to get vaccinated are affected by children who are not vaccinated. So, let's say you want to bring your baby to the park or you want to bring it to someone's house, and maybe you don't know that a child there or someone there is unvaccinated, and then your baby gets affected with something. How is that fair to you or your child? Your baby's too young to get the vaccination, but the people who are reckless and have not gotten their other children vaccinated have affected your child. Not only that, elderly who may be higher risk of complications from diseases can be affected by this. They say that children are healthier and save more lives for multiple years that have vaccinated. Most vaccines are 90% to 99% effective in preventing diseases. And if a vaccinated child does get the disease, let's say, the symptoms are usually less serious than a child who hasn't been vaccinated, which was already done in the study, like I said earlier. It would be more mild side effects for the child who was vaccinated, like swelling, where the shot was given, but it wouldn't last that long, or there would be other side effects like in the study, but it would be more likely that they would survive with a vaccination. Even in public schools or school in general, you need to get your child vaccinated. So most kids that don't have vaccinations are homeschooled, but it doesn't help when there's public parks that everyone are welcome to. It puts other people at risk. A lot of vaccines are regularly inspected to make sure that it's licensed in the United States. The Food and Drug Administration reviews all aspects of the development, including where and how the vaccines are made. And the studies have been conducted in people who received the vaccine also. So they make sure to do their research before they just give their child the vaccine. Also, lots of pediatricians recommend highly that you get your child vaccinated. It's a shame that most people don't, considering your doctor recommends it for you. I don't think your doctor wants to put your child at risk. I think that's the last thing the pediatrician wants to do. But some people go against it. Some people are for it. And since some vaccine preventable diseases still occur in the United States, that could be an issue. So others may travel outside the United States with different areas of different disease outbreaks. So it's important that your child is vaccinated because people traveling into the United States also brings different diseases. And you want to try to prevent your child or yourself from getting sick as much as you can. So, in conclusion, most parents choose not to vaccine their child because they don't want to take any of the risks. But these risks are so small and they're so rare. And there's more benefits to getting vaccinated than not. But choosing not to immunize your children is without risk. Your child can contract illness and suffer problems. Your child can transmit diseases to others, including who may be particularly vulnerable, like young infants or relatives with immune problems. Many cancer patients, for example, can't be immunized. So people who cannot be immunized because it is not allowed for them are at risk, which is not fair to them. And if your child needs to stay out of childcare or school during disease outbreaks, even if she doesn't have the disease. So again, I think it's very, very important that every child or person gets vaccinated. And if you don't believe me, there's more references on it. The references I used was healthychild.org, nfid.org, and caringforkids.cbs.ca. Again, it's so super important to get your child immunized. So if you're refusing to, you should really look at the risks against it, then look at the risks for getting it.